You want questions during or after?
Oh, we can take them during. This is I do this very informally. And what you have to look at is a copy. Actually, I did a much larger presentation on this, and so I'm picking some of these things, and we're actually not going to try to cover all this today. I'll take plenty of questions because this is a huge topic, but I think that if you all are working with, and it's not just adults, if you're certainly working with any adolescents or children, this business of self-injurious behavior is huge. And it oftentimes presents with no suicide intent whatsoever. And so that's why I wanted to go ahead and present it. And we can do this over a couple of different episodes, but just to give you some information. So the first slide is the definition. Sorry about that. Okay, so you can just click them all on if you want to, the way it was done for a different thing. So the definition is that it's deliberate, intentional self-injury. And by being non-suicidal, it is not intended to be lethal. And in fact, the kids, adolescents, or adults will often tell you, I wasn't trying to kill myself, I was doing it for some other reason. Now, occasionally I will get someone who has said, I did it specifically to try to kill myself, even if you think it wasn't likely that they could have done it by that means. It really depends on what their intent is. And as I've noted on this slide, the report is retrospective. You are talking to them about something that has probably happened in the past, most likely, and you're not necessarily looking, in the future of it. That's important because the idea of why they did it can change over time. They may have truly been suicidal at the time, but then later on reporting to you, no, I wasn't really doing it to kill myself. I was just doing it to release some pain or for some other reason. The opposite can also be true. It can also be, and I've had them report it to me, that in fact they've had a history of chronic cutting or injury, and it really wasn't intended to be lethal, but they will report it to me as a suicide attempt, particularly with adolescents that I will get on a chronic basis. I have sometimes they'll tell me when I say, have you ever had a suicide attempt? Have you ever tried to kill yourself? Oh, too many to count is what they'll sometimes tell me. And then I'll ask them to break it out for me. And they will go back and describe any episode of cutting or any episode of injury as a suicide attempt. And so even their own perspective sometimes gets muddied when you're talking to them. The time does change the perception, as I said, both back and forth. And sometimes what started out as being non-suicidal can actually become suicidal and vice versa. So we'll get someone who said, okay, I had it, I had this knife, I had whatever, this razor. And when I started off, I was just going to cut myself. But then I started cutting deeper and deeper. And before I know it, I thought, I'm just going to kill myself with this. So it can change over time, and it can also be the opposite. Someone who starts off and they're going to kill themselves with something, but then once they've started to make a mark, or they've actually cut themselves and they've experienced some type of emotional feeling from that, may say, wait a minute, I'm actually not going to do that. And then it ends up being something more insignificant. However, there's some studies, and there's one I mentioned there from Miller in 2007, that this may be a significant indicator that there is contemplation for suicide. People who chronically injure themselves will oftentimes tell you that they do have suicidal thoughts, sometimes that accompany when they're injuring themselves, and sometimes as a lead up to it. So one of the biggest issues, and that I wanted to share with you all, because you do this on an outpatient basis, one of the biggest issues is, what do you do with people who chronically injure themselves? What do you do with them? They're telling you that they're not suicidal, or they are suicidal, or they're sometimes suicidal. It's a huge issue, because when you're working in an outpatient setting, what is your first thought? What is your first thought when you have someone come in and they've got cuts all up and down their arm? What is your thought? What do you want to do with them? I'm just asking a general question for those of you who work in an outpatient setting. What is your thought?
Casey said she calls me. That's what she does.
Okay. And then what do you do?
That was sort of a joke.
I do a pretty thorough safety plan.
Okay. So your first thought is not necessarily to put them into a hospital.
Oh, no, not if there's no intent to kill themselves or no plan to kill themselves, and it's just kind of more of the superficial cutting behaviors. We'll do a safety plan and talk about supplemental coping mechanisms that they can do instead. And if they have a family member, typically they're the younger population that I see that does this, I'll bring in one of their family members to help with the safety plan with the permission of the individual.
So it may come as a surprise to you or not. You are the vast minority of what happens in an outpatient setting. Because when people are faced with that, and it's not a criticism, it's a reality of people don't always know what to do or where to draw the line between what is something that appears to be part of an injury not related to anything lethal versus something that is more serious and requires hospitalization. People are very mixed about what they should do. Parents, as you can imagine, some of them haven't realized that their child actually was injuring themselves until this comes up in a conversation such as an outpatient office, or maybe there's been some incidental finding in a doctor's office or a hospital. Parents almost uniformly want their kids in a hospital because they can't guarantee at home that they'll be safe. They can't guarantee that they won't injure themselves. And even though you're not necessarily going to prevent anything in the future, it's a long-term process where you're going to treat that. Parents feel very uncomfortable taking kids home. Physicians in the ER feel very uncomfortable unless they've got someone directly that they can consult with. They feel very uncomfortable sending kids home. And all the parents have to do is say, I don't feel safe doing it, and the referral is there. As an inpatient provider, someone who sees kids on an inpatient basis, it's concerning that we have a lot of inpatient admissions. And I don't mean when I say this to trivialize it, but when you hear, quote, just for cutting. I don't trivialize cutting. I don't trivialize injury of any kind. But I also feel that it's important that we are not admitting kids like that to a hospital every single time. That in of itself has negative, implications for chronic. I have a girl right now who's on an inpatient unit down in Clarksburg at Highland. This is her 4th admission, and she's already been at Chestnut Ridge. She's been at Chestnut Ridge 3 times. So this would be her 7th admission since last January. And occasionally she will take an insignificant amount of medication, like she'll take 2 melatonin or something, but the vast majority of time, what has happened is some sort of injury. And she lives in the guardianship of a grandmother who doesn't know what to do. So she ends up at an ER, and then she ends up in the hospital because the physicians there don't know. And if they don't have the ability to consult with psychiatry who can safety plan, they're reluctant to not allow them to be hospitalized rather than return them home. So we get lots and lots and lots of inpatient referrals and inpatient stays because of this. And so it is a huge issue for most people. Okay, you can go ahead and click all the way through those too. So I've given you just a list of these, and you all may be able to add to the list. And I think I've got some on the next slide as well. The thing that we hear about most often is cutting. That seems to be ubiquitous. I mean, they will use fingernails. They'll use razors out of a disposable razor, anything sharp that they can come up with. They'll even take, even on an inpatient unit, they'll take the bottle cap off a soft drink, plastic bottle, and they'll scratch or try to cut themselves with that. So that really seems to be, I have kids who will say to me, quote, I'm a cutter. And so there's a lot of identification. Whole groups of people, kids who'd never even thought about doing it, after they've been around it on an inpatient unit, will go home and do it. And I can't tell you how grateful the parents are to me for having, allowed that exposure to happen. In addition, there's also burning, which happens with lighters, and curling iron. Some of the worst injuries I've ever seen, I've had patients, actually an adult patient, who used a curling iron to burn herself routinely. That certainly happens. Carving words into skin. That is absolutely more frequent than what you might think. Some of the words that they will carve are fat, slut, whore, those kinds of things. They'll into their legs or into their arms, and they'll use pins to scratch and to do that thing. Severe scratching occurs. If they can't get to anything else, they will scratch themselves right down until you've got a significant abrasion, which can clearly. Biting, also far more common. And one of the things we do when we do a physical exam is we're looking for bruises, and we're also looking for evidence of bite marks, and we actually ask them to identify where the bruises came from. Biting can certainly be common. Using abrasive objects, they'll use sandpaper on their skin. Of course, there's the infamous eraser burns that they'll do. They'll drip acid, they'll use bleach. Let me go to the next one. And they'll stick things in them. I've had patients, in fact, I've had a couple of patients with really severe chronic readmissions from putting staples in open wounds, tearing out sutures from significant lacerations, and putting staples or other sharp objects into their skin, under the skin, in a really damaging and significant way. And those are really severe and very difficult to treat. Right before that was rubbing glass, and that also can happen, again, abrasive. The last thing I'm going to talk about, just to kind of bring this to a close today, is the functional model. And this is probably one of the most important things, and I bet if you're seeing adolescents or adults either that injure themselves, these are the questions that you want to know, because what is it that this does for them? That's always an important question to ask. Why did they do it? What is it? And so some of the things that are common are the ones that I've listed here, which is it creates, a feeling. Kids will tell me everything from it allows me to feel something when I feel numb, or I don't feel anything when it happens, or it's a release of emotion of some sort, or a release of pain, or it's a distraction from other psychological distress. There is associated with some types of injury, particularly something that's a sharp, pain. There is an endorphin release. There is an adrenaline type of release that can be associated with those. And that in of itself can also have almost an addictive quality to it. So there can be, different psychological states with that. Some people use it for attention. They can't get attention from anybody else, so I'll just carve into my arm. My mom doesn't pay attention to me. The young lady that was just admitted, that I just talked about, who's had the 7 admissions, she's in the guardianship of her grandmother, but her mother is around, and her mother wasn't speaking to her. So she made all these cuts on her leg and her arm, and then contacted her mom, so her mom would know. And when she ended up in the ER, her mom came into the ER too, so she was able to get her attention. Again, the psychological state reduces tension, anxiety, distress. Sometimes people have a hard time explaining what it is about this that reduces their tension, anxiety, but I have some people who do it when they're overwhelmed, or they feel like they're going to have a panic attack, or they're distressed about some event. They take that psychological, emotional distress and they translate that into physical pain, and that allows them to redirect their attention to that. Lastly, they use it to escape from tasks, demands, or even boredom. I've had adolescents, I've certainly had more than one adolescent male who said they do it when they get bored. And they do a lot of the self-tattoos where they will use, something sharp to make a puncture, and then they'll use dyes and things to create their own kind of a tattoo. But again, this is in the context of self-injury and what that does. So I'm going to stop here because that's been a lot, and I'll continue. Any questions from anybody? Any thoughts or your experiences with any of this?
Excuse me. There was a chat question.
Okay.
Wondering if tattoos do count as self-harm.
I think they do. But again, this is what I would say. I think, you know, you've got somebody who's got one little tattoo, something like that. I don't see that. When I see people who come in with multiple tattoos, I ask them about their tattoos. I ask them what they mean to them. I ask them about their experience of getting a tattoo, what it was like for them. I explore that with them. But I have personally found that there are people who do have a sensory reaction to the pain that's associated with one, with the adrenaline, the endorphin release that's sometimes associated with that. But I also think that oftentimes it is associated as a form of self-injury. That's been my experience, certainly. But I think you have to ask them and, you know, see what they think.
No, I can just speak it.
Mm-hmm.
Okay, I have a couple questions for you or comments. I'm the one who put the comment about tattoos, and I've had several patients who have done home tattoos. And one of the things they say to me is that they become addicted to it. And to me, that sounds a little bit like cutting, because I think people become addicted to the feeling, or what they call addicted. The other comment I had was, it seems to me that it reminds me of an autistic child who's beating his head against the door, not because he wants to hurt himself, but because the pain gives him a sense of connection with the world. And so for some people, I think that cutting gives them a connection to the world, that if they feel pain, they feel like they're alive at least.
They sometimes say that. I've heard them say things like that. It makes them feel like they're alive, or, you know, certainly I've heard people say things like that, for sure.
So that's just an observation on my part.
No, I would agree. I think those are accurate observations.
Thank you so much for that.
Thank
That
you.
was
Thank
wonderful. And everybody, Dr. Goodykins will continue that. And of course, we'll send that in those reminder emails. We have just about 1 minute left. I wanted to let everybody know that our last session for the year will be on the 18th. And Amanda is going to give it for us about holiday parenting stress. So very applicable right now. And did anybody have any final questions right before we dismiss? Okay. Thank you all so much.
you.
Any emails will get everywhere. Thank you.
Thanks.